And hi, everyone. TJ Alt, I-45 now, and welcome to another edition of UTMB Health Insights. We're glad to have you along for another edition of our show here in 2025. Hopefully, everyone survived the snowstorms that we had last week. We know that everyone who's with us here today did. We have a different type of show. You know, we've focused a lot on research and different of clinics, not clinics, but different programs we have here at UTMB Health. And now, what we're bringing to you something a little bit different this time around, and it's about making sure your health is in really good shape, and that all starts with making sure you know where to go and who to see. And we have great guests on with us here today to be talking about that. I'm going to start here in the studio since she braved the great weather to get over here with us today. And that's Ann Fergisi. She is the UTMB Hospital Administrator for both the Clear Lake and League City hospitals. We'll be talking to her later in the show here. But also joining us is Dr. Matthew Hay, pediatrician over at the UTMB Health Texas City Clinic. And he's going to be talking about how you take care of your kids. And then his cohort over there, Dr. Peter Bashara, who takes care. Once you turn 18, you get handed over to him over there at that Texas City Clinic. And then also joining us is Stephanie Farr. She heads up a whole lot of things. One thing we'll be talking with her is about what's happening in Angleton, Danbury, also the clinic in Lake Jackson on the way. And then most importantly, the new clinic in Friendswood. Stephanie, I'm sure you're pretty excited about that coming online here pretty soon as we will. So Stephanie and Ann are going to join us here in just a little bit, but let's go ahead and I want to start off with the show here and talking with Dr. Hay and with Dr. Bashara here too about the operations they have over in Texas City because I think one of the things, Dr. Hay, let me just kind of start with you on this, is that a lot of folks don't realize that when they hear UTMB, there's still some of that that's kind of stuck in their head about, okay, UTMB, Galveston, League City. But clinic-wise, there's a very active and bustling clinic that you have there in Texas City. Talk about what's all offered there.
Yes, good morning. Thank you, TJ, for the introduction. I've been a pediatrician with UTMB for 35 years. Our office right now is located at the corner of Emmett F. Lowry and Century Boulevard. We've been in this location for just over 10 years. But prior to that, we were in the pediatric clinic over by Mainland Center Hospital. So we have been in the community, if you go back to Dr. Raymer and Dr. Judice's days, for close to 50 years. On the pediatric side in Texas City, we've got 5 pediatricians and a nurse practitioner, and there's a lot of experience in our office. And for the general pediatricians, have an average over 20 years of experience per doctor. We take care of newborns. We take care of all the way through high school, age 18, as we mentioned. We do well-child checkups, immunizations, sports physicals, and all the typical sick visits that you would expect. We also have a significant interest in treating and preventing childhood asthma, and we're the largest group practice in the area that does evaluations and treatments for children with ADHD and similar conditions. In addition, we have Dr. Matt Probst. He is a sports medicine trained pediatrician. He can handle all of your non-surgical sports-related injuries, as well as sprains and strains and broken bones. We have casting, and he's our concussion specialist. A lot of the school districts in the area use him to clear kids to get them back into sports. And then while the primary care portion of the clinic is open from 7:40 in the morning till 5 p.m. Monday through Friday, this clinic is an urgent care that takes care of both children and adults from 9 a.m. to 9 p.m., 7 days a week, excludes a few of the big holidays, and they take scheduled appointments besides walk-ins. So that's all the things on the pediatric side that we typically offer here.
And then after you've seen him on the kids' side, then Dr. Bashara, you take over at that point. I like how you put it the other day. Once you turn 18, you're mine at that point. Talk about, because there's a lot that goes beyond just primary care for adults in that clinic in as well over there. that goes to health beyond just, hey, coming in for your general checkups, right?
That's true. So as you mentioned, after the patient turns 18 years old, it comes to the adult side. And we continue taking care of the patient after that period, but not only for like the checkup and the primary care issue, but also to go along with UTMB policy to bring the best quality of care to the patient and bring more specialty to the clinic. Our clinic is multi-specialty center that has multiple options. Actually, we have a cardiologist, we have an ENT, we have a urology, we have a lab and X-ray here also available in the clinic. We have an optometry along with the urgent care that's open, as Dr. Hay mentioned, from time 9 to 9, 7 days a week. But also we were able also to get more specialty in the last few years. We got a psychiatrist and psychotherapist. And again, this has actually bring a lot to the patient here in Texas City. As you know, the Texas City Clinic also not only the multi-specialty center, but also taking care of different populations. So we have between geriatrics population, the old folks, but also we have a lot of new people that they moved actually here to the area with building a new structure around, along with the patient that comes also from the refinery and Texas City Port. So we're trying to create more specialty. We create all more taking care of all those patients around this area.
One of the things I find fascinating about there's a lot that goes on with what we look from the road. It looks like a pretty small clinic. I know it's a little crowded. I was in there here recently, but you get so much done out of there. And what I think that's convenient is maybe a lot of people don't realize is that its location is really centrally located, particularly for that growth on the west side of Texas City. Also, the growth that's happening in Lamarck, more toward the west, toward push toward Lamarck and Hitchcock, that area. Santa Fe's an easy trip over. Dickinson's a very easy trip over as well. And y'all even have patients that come up from Galveston, don't y'all?
That's true. And actually, the patient like, again, the idea of they come to the clinic not only to see the primary care, but also they see their specialty as well. So sometimes we offer that here in the clinic that the patient sometimes comes in the same day, taking care of multiple appointments in the same times. We have actually seven adult provider and we have 2 nurse practitioners. So the appointment actually easily to be made at any time to see the doctors, and the same day also they can see the specialty available. And this bring a lot of patients from not only from Texas City, but also, as you mentioned, from Galveston, from Lake City. Some patient even comes from farther than this, Hitchcock as well, because they like the idea of I can come to the clinic, I can get my checkup, I can get to see my specialty, I can get my X-ray, my labs, and everything in the same day. So they feel so happy coming here in the clinic in the morning, finishing everything, and just go home with everything taken care of.
Dr. Hay, one of the things I wanted to get you to explore on is that on that urgent care center, obviously for any UTMB Health urgent care center, anyone can come in. But the fact is that it also has some pediatric specialty in there for patients. So you have your kiddos in to bring them in. Talk about how that urgent care works.
So yes, the nice thing is you can either schedule a time slot or you can do a walk-in. And we have pediatricians that do staff that in addition to family medicine. So we can take care of all the different ages. They can do the flu test, strep test, COVID tests, and there are X-ray in the facility. Dr. Justin Surratt is a pediatrician and he's the medical director of that clinic. And so people will specifically, if they have kids, sometimes try to find out what days he's going to be working. But all of our caregivers in that clinic can do it. If you come in for urgent care and it turns out that you're already our patient and we have an opening on our side, the parent will also get offered the chance to say, hey, you walked in for urgent care, but did you know that Dr. Hay had a cancellation and he has at 10:30, and they'll just move them over. So our front staff is really good about looking for that part of it. If maybe the patient just assumed that the schedules were full, not realizing that we could take care of those things as well. So it gives people good options.
One of the things, because you talked about scheduling up, one of the things we're starting to see at all of the UTMB Health facilities, and this came up even in a recent visit of my own, is is that the ramp up of number of healthcare providers at each of these facilities, UTMB has put a lot of investment in the last couple of years to do so. Really, Dr. Bashar, you talked about this with me on Monday, is that it is nowadays the getting in, you can get in quickly. Like I go online today, I can have an appointment tomorrow in most cases. It's no longer the 2-3 day wait or even longer for that now, correct?
That's true actually, and that's actually along with the quality of care of the patient. That yes, the patient can call and get an appointment in the same days. As you mentioned, UTMB hired recently a lot of doctors, and actually here in our clinic, in the adult side, we got a new doctors I think last week, and we have one like 3 months ago, and we are in the plan also to hire a new physician maybe in a couple of months. So that give a lot of options for the patient to come and be seen in the same days when they wanted to be seen. Along with the variety and the experience, we have physicians that has been here in the clinic for over 30 years. Also, we have physician 10 years and 5 years, and all of them, they follow the same quality care for the patient, along with a UTMB policy taking care of those patients. So yes, the patient can call and get an appointment, as Dr. Hay mentioned. Even sometimes when they go to the urgent care, they offer to be seen in the primary care because there is an opening, and the patient can choose to be seen with the primary care, which is actually the patient like that. They wanted to see their primary care provider at any time when they wanted to be seen. But also here in the clinic, and I think along with UTMB as well, there is a lot of my chart messages and phone calls and all the stuff that actually behind that there is a lot of our awesome nurses that actually taking care of the patient on the spot and call the patient the same day, try to get them everything done. And there's a very good communication between us and the nurses and the patient that actually work very well for the patient care.
And Dr. Hay, one of the things that I think we need to kind of stress right now, particularly in with children, is that there was so much about COVID distancing and in virtuals and stuff like that. Nothing really beats getting your kid in for those different wellness checks. And right now, I think when we're seeing rises of measles in areas that we had not seen in a while, the tuberculosis stuff that we're seeing in there, I would think you're really encouraging folks. Hey, listen, get your kid in just for that well care check right now.
Yeah, generally, pediatricians will tell parents there are basically two things that we get asked all the time about what they can do to prevent problems or keep their kids from getting sick, and they're looking for a vitamin or this or that. The truth is, the two things that parents can do is, one, have those regular checkups. Some people think that there's only certain times, but children should have an annual well child checkup once they've gotten past age 2. And the baby checkups are obviously a lot closer together. We talk about diet, we check for development, we answer parents' questions, growth, some things that parents see the child every day, they don't realize that something's not quite right, and we can spot that. But the second is really childhood vaccines and immunizations. Social media sometimes makes that seem to be controversial, but medically speaking, we don't think it's controversial. The problem is that there are 1 to 2 generations of parents and grandparents that don't understand or remember the childhood deaths from the things you mentioned, polio and measles and whooping cough. That's because the vaccines worked. And so that's great, except that you have to keep a 95% immunity in the community to have that not happen. And unfortunately, in the area, and this is throughout the country, we've dipped below the 95%. And that's why there are measles cases in Houston, and Galveston County is experiencing the most cases of whooping cough than we've had in decades. They're going to come back if we don't immunize. And unfortunately, a new group or generation is going to probably have to deal with. The young physicians haven't seen them. Us older doctors at least know what we're looking for. And this is the worst influenza outbreak in years. We're in the midst of the influenza A, but influenza B is now creeping up. So it isn't too late to get your flu vaccine for both kids and adults. One, it keeps, even if you get the illness, it's milder. But the regular childhood vaccines should be addressed to prevent all of those illnesses that people haven't seen in decades that are coming back, as you mentioned.
And that's so important right now. And again, we had this basically 2.5 years of disruption within the medical field, school fields, and stuff, everything else. And like you said, the politicalization of any type of vaccine or immunization that's out there. We should point out there are still some on the books that are required by law out there before you get your kids into school. But right now, Dr. Hay, let me ask if, someone's got, I was telling you when we all did our pre-meeting on Monday, a good friend of mine, her daughter, has got the flu pretty bad. And then everyone around them that have kids, same thing right now. And that could be very risky because those immune systems aren't boosted up right now. But right now, what's your most concerning outside of flu that you're seeing that you're really encouraging parents, let's take an action on right now?
Pertussis, which is whooping cough. In an adolescent or an adult, the translation for where pertussis comes from stands for 100-day cough. So if you get pertussis, you're going to be sick for 3 months. Coughing, but you're going to be otherwise acting like, gee, why do I have this cough for like 90 days? The problem is if you're an infant under 6 months of age, whooping cough can be fatal. Right. Because the airways close up and treatment can make you not contagious, but the antibiotic that's used, azithromycin, doesn't fix the illness. It just makes you stop spreading it. And so while we put people on medicine, the rest of it is just kind of a cross your fingers and hope. And you don't get pertussis if you've had your DTaP vaccine that's given as infants and through age 4, and then that's also the 11-year-old shot. So there's boosters all along because immunity fades over time.
And I wanted to get both of y'all's input on this on specific because as I was going over the reports, looking at the CDC reports on tuberculosis right now. I was trying to remember, if I actually had a tuberculosis vaccine immunization. I remember it's the little circle star thing, and I remembered, oh yeah, I did have that. That was what reminded me of that. Right now, because we're not at like a pandemic or epidemic level, but we're starting to see those increases. What are your advices for folks right now, particularly for adults, Dr. Bashar, of dealing with tuberculosis? Because that can be so invasive and so dangerous, particularly for folks in an older age group above 60.
So again, the preventive medicine is very important for the patient. It's very, very important that when we think about if the patient has some symptoms, the patient need to be seen with a physician. So again, as Dr. Hay mentioned, yes, we offer the vaccine for the patients. Regarding the tuberculosis, there is no vaccine right now. But if the patient is sick, need to be seen. If the patient having some cough, some symptoms, they need to call and make an appointment, and we would be able to see them. Not only that, but also for any other thing that we recommended the patient to come for the checkup. We need to see them more, at least once a year, to do all the labs and check everything to make sure that we handle the preventive medicine in the right way. I can't tell you how many patients we actually discover like some issue and some diseases and some cancer actually that can be treated very well and easily if we actually catch it at the beginning. The same as for TB as well. If we catch it at the beginning, we can get them with an infectious disease and get treated very quickly, and they will not have an issue. And that's why about the quality care here that the patient will, that there will be always available appointment for the patient to be seen. We are trying, as well as Dr. Hay mentioned earlier, from the adult medicine as well, is to teach the patient how important that the checkup, how important the preventive medicine, how important to get your screening per the age, like when you turn a certain age, to get your mammogram, to get your colon cancer screening, and also for the vaccine. Even here in the clinic, last year we have uprising of the RSV pneumonia. And actually, we were able to get the RSV vaccine here in the clinic. We create a nurse visit for immunization, actually for free, of course, based on your insurance, to get all the population aware that, hey, we have the vaccine here. If you're able to come and get your shots, that will be good for you to prevent the RSV pneumonia to happen. Not only the RSV, but all the shots actually, or most of the shots, is actually available in the clinic, and it's available for free again, based on the insurance. And it's actually on the spot. You can call and get the appointment in the same days and get your shots.
The most important thing I think we want to make sure to folks is just get in at least once a year, right? Just get in.
At least once a year, get in.
All right. And yeah, go ahead, Dr. Hay.
Your star on your shoulder is probably actually smallpox, unless you grew up in another country. The BCG vaccine for tuberculosis isn't done in the U.S. We do see it when people were born in Mexico, but this country's never adopted a tuberculosis vaccine. I can't get into all the details why, but
that's why I needed you guys on the air here to correct me right off the bat.
So tuberculosis can be treated with medicine. Back in the 30s and 40s, the only treatment for tuberculosis was they just hospitalized people for 9 to 12 months.
Right.
And so now there's medicine that can be prescribed that can keep you from getting really sick, and medicine you can get if you were exposed that will keep you from ever getting it.
The big thing too is, as I said, it gets down to the front lines of this. I mean, you two are particularly on those front lines of things. We want folks to be well, but it does take getting in there, the number of doctors being hired and ramped up across. I think one of the things we should give, UTMB had already started addressing this. Dr. Reiser made sure it was ramped up, but addressing a big issue. A lot of folks were complaining for a while, like, I can't get in for an appointment, or it's taking so long. We're not seeing that now. We're seeing that now there are openings. Like I told everyone Monday, I had to change one of my appointments with my primary care doctor, and I just went online and said, oh, wait, I got tomorrow morning. Boom, did it online. You can also call the phone number and stuff. We have the link up on the site for folks to go that route. But again, it's get into those frontline doctors wherever the clinic, because while we're talking about with U2 in Texas City, we should also point out we also have UTMB Health has the PPO clinic on Harborside in Galveston. They have clinics all over the region to be able to go to for your general wellness. The one next to me is in Webster. Both there's pediatric side and there's also the primary care side for adults. They're right on State Highway 3 over in Friendswood. And we'll talk a little bit more about even more at Friendswood here in a little bit. But it's avoiding having to go see Ann's hospitals if they get in there right now. Ann's is smiling at me. We'll get to her in a little bit. Anything else before we wrap up with the two of you? Y'all actually have patients to go see here.
Yes, we do. I will say that the other thing your primary care provider is helpful is getting you into a specialist if it's necessary. Because if you call yourself for a specialty appointment, the time period may be longer than if your primary care provider puts the referral in, because then the specialty office knows, hey, the primary care provider feels like they need a second opinion. And so that helps expedite the specialty group, whether it's Galveston or whether it's League City or Webster or Angleton, Lake Jackson. All of those places have UTMB specialists. And it's easier to get in after your primary care provider has assessed you in that setting, even if your insurance doesn't need a referral.
Right. Make sure those front lines are there for you. All right. Dr. Peter Beshara has been on with us, and also Dr. Matthew Hay. They're from the UTMB clinic over in Texas City. Thank you both for being on with us, and let's go get some patients healthy with you. And as I said, I think both y'all have openings tomorrow for sure too. So those of you watching the show, if you haven't gone to see the two, make sure you get, well, there's more than just these two guys, by the way.
Yes.
Over there. There's plenty over there as well. And then at one point, we're going to talk about the expansion of the psychiatry that's happening over there, because mental health becoming more and more important. Any final thoughts before we hand things off from you guys?
We just appreciate the opportunity, TJ. Thank you so much.
Thank you.
All right. Thank you both for being on. When we come back, one of the things is everyone knows about Jeannie Seeley and John Seeley. But what about League City and Clear Lake? We got a lot going on in that area, too. We got little med centers building up thanks to UTMB. And we'll be talking about that right after this.
There's nothing more important than quality health care for you and your family. That's why UTMB Health is in the communities where you live, providing easy access to innovative care. At UTMB, we know our patients need personalized care to lead healthy and fulfilling lives, providing everything from primary care and specialty care to urgent care and emergency medicine. UTMB knows healthcare. UTMB knows you. To find a UTMB doctor near you, visit utmbhealth.com.
And welcome back, folks, to UTMB Health Insights. We're glad to have you with us here today as we talk about ways to make sure you stay healthy. And one of those is knowing where to go and what you need to do. And joining us now to talk, part of that is, doctorate. I know I was going to screw this up. This was our whole line before the show. And for Casey, she is the hospital administrator for both the League City Hospital operations for UTMB Health and Clear Lake. And thanks for coming on with us. I appreciate it. And as I say, folks that saw when League City opened up its presence, it started off as clinics, and then the hospital added later in League City, right there on Interstate 45. So the people are more in common with that. But the fact is that the demand is there for patients. Let's start with the League City operations, just of where things are now, because I remember when it just opened up, and it was called Victory Lakes back in the day.
Yeah.
For that, now it is an entire complex.
Yes.
In that, talk about what's available over there.
Sure. And, TJ, thank you. Thank you for inviting us to talk about this. People want to receive care close to home. And that's why I believe our mainland campuses have been so successful. And we're able to provide that high level medical center care close to their home, where it's convenient for families. And we're proud of that. Now, the League City campus opened up hospital operations in 2016. And you're exactly right. You started off as an ambulatory center, outpatient clinics. We opened up a few inpatient beds, and currently right now we have just under 100 inpatient beds in which you can receive services over there. It is conveniently located right off of 45, so everybody sees it, but it's also a little bit embedded within the Victory Lakes community as well. So we see a lot of individuals just driving in for care, whether it's for the emergency department, for surgical services, whatever it may be. The League City campus is a primary stroke facility as well. So we have trained up and surveyed for that as well, done very well. We just finished our level 3 survey for our trauma program as well. So we have very qualified individuals within the campus in order to take care of traumas. We are the outpatient surgical hub on the mainland for any eye needs, plastic needs, orthopedic needs, and GI. So the campus has significantly grown since its inception, and we're full. And we're glad that the community is choosing us for services.
And the ability, when it comes, to expand.
Fantastic.
Out
Yes.
there as well.
Yes. We have lots of land in the area, and so we are in the process of thinking about what is the next step in order to meet the community's needs. So there's lots of discussions happening in regards to that as well.
And one of the things too, and while it's not directly UTMB Health, the partnership with MD Anderson and having that cancer clinic right there next to your hospital, how has that helped with operation with systems as well? Because there's sometimes those crossover of patients,
Sure,
and they're getting that all healthcare in the one area.
Yep, and that's right. And I think a lot of people don't realize that MD Anderson and UTMB all fall under the umbrella of the UT system. And so, it's great to share a campus with them. It's great that MD Anderson is there so that individuals can receive that specialized cancer care right in the community. And if there are medical needs that we can support them with at our UTMB side of operations, we definitely partner back and forth in order to do that, so our community is taken care of.
On the hospital side of things, talk about there at League City as an ER.
Yes. Yes.
There. Talk about its level of care that they can provide there at that ER.
Sure. So we have an extremely busy emergency department at the League City campus. And I must commend the staff that work in the emergency department, because they do a phenomenal job taking care of patients and throughput. Because I know people go to the emergency department and they don't want to wait 2, 3, 4, 5 hours to be seen by a provider. But the physicians and the nursing staff have done a wonderful job And even if we're overflowing with patients, managing to see the patients quickly, addressing their concerns, and moving them on to the next level, whether it be home or whether it be a patient bed. So our level 3 trauma leveling is, uh, it signifies the level of care that we're able to provide both in our emergency department as well as in our ORs and in our inpatient areas.
And then as we pointed out that you have the hospital side, which is your main focus there, but there's the clinics that are nearby too.
That's right.
The day surgery, which is that place is super busy.
It is
all the time.
It is
out there. Now let's head up the road to Clear Lake. Obviously, that's in an area right off of Highway 3 and Blossom,
Yes.
as I like to say. And what's great about that location is, while that may not have been in the initial when it happened plans for UTMB Health, that the failure of one hospital and then UTMB taking over those operations there, talk about how that's enhanced for medical treatment, particularly on the hospital side in that area.
Sure. So the acuity of patients that we see at the Clear Lake campus is a little bit higher than the League City campus. The specialties, the surgeries, all of that happen at the Clear Lake campus is a little bit higher than at the League City campus. And it just to give a brief overview of the campus, the campus has just under 200 beds, which includes beds for our adult patients, medical surgical beds, ICU, as well as pediatric. So we have a pediatric inpatient unit, a pediatric emergency department as well, which is staffed 24 hours by pediatric emergency room physicians, which is great for the community, for all the parents that need to run their kids somewhere for services. I know I have several times with my children to our PDED. And so the Clear Lake campus also is a level 2 trauma capable facility, which means we have all of the subspecialties available to our community if there was a trauma that came in. And I say capable because we have our official survey with the American College of Surgeons scheduled for this summer, but we have readily available all the subspecialties that you would need for this trauma leveling. We are also a comprehensive stroke center as well, in which we can take care of any stroke needs, whether it be through medication or whether it be through intervention. We have teams that are ready to go around the clock in order to take care of those needs. We just recently recertified for our chest pain accreditation as well. We have 3 active cath and EP labs on the campus, and we have a very strict protocol on how we manage chest pain patients on the field once they arrive to the ED, if they have to go to the cath lab, how their treatment is managed while they're in the hospital, and even post-discharge. And so it really highlights the quality and the level of care that we have and the prioritization of UTMB to ensure that all these patients are well taken care of. I also mentioned to you that we have our pediatric emergency department, as well as our pediatric inpatient unit, which is a 15-bed unit. And we have the ability to, treat floor level patients, medical surgical patients, as well as some more acute patients in our hospital as well. We also have a labor and delivery department, as well as a NICU on the campus as well. We have providers that are on campus around the clock. So regardless of what time you arrive, there will be a surgeon on site. There will be an anesthesiologist. There will be a laborist. If you want to deliver your baby, there will be somebody to take care of your baby in the NICU. There will be people on site to take care of you, regardless of what time you show up.
In fact, we're showing some of those operations right now as you're talking about those around. What are some of the other specialties that are available there at that Clear Lake?
Sure. So we have cardiology, which is big. We have vascular surgeons and vascular care that's available. We have neurosurgeons who will do surgical procedures in the brain as well as the spine at the Clear Lake campus. We also have, of course, our trauma surgeons that are readily available to take care of business. We have our pediatric specialists that also go into our surgical suites as well. Around the clock, we do have intensivists to take care of and manage our ICU patients, as well as very qualified hospitalist staff, providers, physicians, and mid-levels to take care of those that are in our adult medical surgical beds.
And then also too, should point out right next to the hospital is the clinic operations too.
Yes.
The physicians building there. Talk about what's all over there that helps support the system.
Yep. So we have orthopedics. Down the road, we have primary care, which we had a great discussion on a little bit earlier. We have a lot of pediatric subspecialties that are over there, cardiology that's there. So pretty much if you need a specialist, they're in the area. Whether it's in the Webster area or whether it's in the League City area, we have you covered. So you don't have to go very far for care.
Right. And that's been the whole point of this show, we should point out, is that, it's not far. And I'm a little biasness on my part is because the Clear Lake operations are like 10 minutes from my house. I live in Nassau Bay, and it's just a straight shot up to Highway 3. I turn right. I either stop at, the primary care clinic with my Dr. Sood is there, or I go on over to the hospital for either any of my labs, any of the radiology, any of that, all can be handled there. And so that's been a great addition to that. How many beds are available at the hospital?
At the Clear Lake campus is just under 200 beds.
Gotcha. And what may be coming down the pike there at that you can reveal that we're going to have at Clear Lake in the near future?
Well, we continue to work on advancing our cardiology program that we have. What is it that we can do? What is it that we're going to support both in our cath lab and in our ORs? We continue to work very closely with our neurosurgeons as well in regards to building programs that we're able to do on the Clear Lake campus as well. So those are some upcoming things that are in the pipeline for Clear Lake.
And the patients that come in there, are they just from that immediate area of Clear Lake? Or are you seeing them from all over?
So we see patients all the way from Pasadena. And occasionally we'll get pediatric patients that are coming in all the way from Beaumont as well. So there's a big reach. The Clear Lake campus is the only one that is in Harris County. So we butt up against a lot of smaller cities that are around us, which is fantastic for our community, right? Mm-hmm. They have an easy access to great care and lots of specialties that are right in their backyard. So we do. It's more than Webster and it's more than League City. We have lots of communities that surround us that we often get patients from.
Right. While we're on this, that area, because it'll tie in some, let's bring in now Stephanie Farr, who, Stephanie, thanks for being on with us here today too. Let me get our screen adapted. So we're having trouble there with everything reacting the way it's supposed to. There's Stephanie, but now I've taken everybody else out. Let me, there we go. That's what we need to do. Hi, Stephanie. There we go. Now we can see you.
Hey, TJ.
Better. And Stephanie's, I always like to, we're going to start doing like Saturday Night Live, give you jackets when you've been on with the show twice with us here. But talk about, because we'll get down to the other operations now, is some exciting news, talking about New Forefront. That's kind of that Clear Lake area there, but the new clinic coming in Friendswood.
So yes, we do have a great new clinic coming online in Friendswood at the end. Let me try that again. At the beginning of March. And so we're very excited. We actually currently have 20 rooms of primary care that is in a building close to this new building that you're seeing on the screen. But we are going to actually double the amount of exam rooms that are going to be available to the Friendswood community. So we're very excited about this, and we're going to be able to provide specialties in this location, which has been something new for our community in the last couple of years that we want to go ahead and provide to UTMB's patients. And it's by the request of the patients of being able to bring specialty care closer to where they live instead of having to travel to maybe Galveston or Clear Lake, even though we love our partners in Clear Lake. Anne and her team have been great partners for us, not only in the Friendswood community, but also out in the Brazoria County market. And I think that's one of the great things about UTMB is that as an enterprise, we all work so closely together to make sure that we're caring for the patients the best that we can in the right locations.
Right. And this location here it's on South Friendswood Drive, not too far away from the intersection of FM 528 and FM 518 there, correct?
Correct. That is correct. Yes.
And
we're also going to have a pharmacy as well as Echo Lab, and we'll have radiology services on site. So that will be something that's nice for the patients to be able to access.
Well, it's going to be nice when it comes online. And we're looking still on top for 1st of March.
Yes, we are. We're looking at March 10th as of right now. I confirmed that yesterday afternoon.
That's going to be something else. But, and again, it's going to have those specialties and everything else. And for you, Ann, that means that we probably are now able to see another very active clinic to be able to funnel to the operations that you have just
That's
down
fantastic.
the road.
Yeah.
Right.
Mm-hmm.
There. While we've got you on, Steph, let's go ahead and also talk about some exciting stuff that you guys happening down in the Brazoria County side of things as well.
So, Brazoria County and UTMB in the last 10 years have grown so much. Excuse me. Just the Brazoria County market for clinic visits has actually increased by 63% in the last 5 years that I've been with UTMB, or back at UTMB. Let me state it that way.
All right.
But let me start at the southernmost point that we have clinics, and we are actually getting ready to bring online at the end of March a new clinic in Lake Jackson. That clinic will be a hybrid of both urgent care and primary care. So you'll be able to access either one, 9 to 9, 7 days a week. So it will be a nice addition to that community for UTMB. We currently already have specialty care, women's health, and pediatric care in the Lake Jackson market. So this is just another addition to services that we'll be able to provide directly to that community, to Freeport, and those southernmost cities in Brazoria County.
That's very exciting to see that going on, because that's an area in many ways that the getting the healthcare and the general healthcare is struggling in many ways.
It is. It's an underserved market, and we have been working very closely with the community to find out exactly what do they need, what services do they need a little bit closer to home, and try to bring those services out to the community. So we have added bariatric care. We have added vascular surgeons, cardiology, like I said, women's health. And just as some people do not know this, UTMB is the only place in Brazoria County where you can actually deliver. We have the only labor and delivery unit in the county. So we definitely encourage people to seek care with us if they are wanting to deliver in Brazoria County, which a lot of them do. And our labor and delivery area in the hospital has actually had a nice little facelift in the last year. And so we are ready for patients to come in and deliver with us. And we have great healthcare providers. We have 3 MDs, and then we also have a nurse practitioner. A physician's assistant that actually assists us too. So it's a great partnership that we have.
Wow. When you just said that, I'm just so shocked to hear that, particularly that southern part of Brazoria County being able to have the only place for labor and delivery to be had there, right there, and that's huge. I mean,
That is huge.
now they're either going up into Fort Bend County, or they're going into Houston, or they're coming to Galveston for things. But now you're able to offer those services there. When we come back, Stephanie's going to have some real exciting news. They're adding more robots. If you remember, one of the times Stephanie was on with us, they had robots that went around and help out things. Now they got robots doing surgery. Not not by themselves. But anyway, when we come back, we're going to talk about that and wrap up with Stephanie and with Ann right after these words from
There's
UTMB
nothing
Health.
more important than quality health care for you and your family. That's why UTMB Health is in the communities where you live, providing easy access to innovative care. At UTMB, we know our patients need personalized care to lead healthy and fulfilling lives, providing everything from primary care and specialty care to urgent care and emergency medicine. UTMB knows healthcare. UTMB knows you. To find a UTMB doctor near you, visit UTMB Health.
And welcome back to UTMB Healthcare Health Insights here on I-45. Now, Stephanie, talk about the new robot you have happening on the surgical side.
Yes. So our day surgery unit actually has just acquired a new robot. Before it was only available in Clear Lake and in Galveston. And so now we have those abilities in the Brazoria County market so that when patients need certain types of surgeries that they will be able to actually acquire them at the Angleton Danbury campus instead of having to go to another campus. And that, that's always our number one goal, is to try to keep patients as close to home as possible. As you probably know, we have done studies that show that people that are able to go home very quickly after surgeries have a better recovery rate. So it's very exciting.
Yeah, and what type of surgeries can he has a name too, right? Did you tell me?
No, this one does not have
Oh,
a
that's
name.
right. I'm sorry. I
Yes.
should point out. All right, this one doesn't have a name.
No.
There's another robot. We'll talk about Leonard here in a little bit. But anyway, what type of surgeries can this robot perform?
Our vascular surgeons are, vascular surgery, our urology providers. Pretty much all of the providers that we have in the Brazoria County market can come and do surgery in the Angleton Danbury campus.
That's awesome. Now,
Yes.
let me get to Leonard. So I should point out. So for those that are familiar with our show, when it had a different name, we did do a story on, there were two robots that went around on the Angleton Danbury campus, which, by the way, goes more horizontally than vertically. So a very large campus. And so these robots would go around and they help deliver medicines and and other things, and where someone physically doesn't have to go one side of the campus to the other. And it's gotten so busy that you've had to add a third one to the campus there, right, Stephanie?
We did. Yeah. So we have Ann and Dan that have been here since the inception of bringing in the Moxie robots. And because we started getting so busy, we have added another one, and they have named him Leonard. Leonard has on a pair of glasses, so he is very distinctive. Anne has nice little eyelashes and some lips. And then Dan has a nice little mustache so that everyone can distinguish who is who. They also have badges so that they can access those areas that might be restricted.
That's pretty cool.
Yes, so they are integrated, much integrated into our systems.
Anne's sitting over here. She's jealous. She doesn't have robots roaming around her campuses in League City and Clear Lake. You won a robot.
One day
we're gonna have robots around. I just wanted to kind of see what and so now where'd the name Leonard come up from that third robot though? I gotta ask.
I am, I'm really not sure. I'm thinking that they were thinking of the Big Bang Theory and Leonard, because they did put a pair of glasses on him. So he does.
Leonard
He
Hofstadter.
does. Yes, he resembles Leonard.
Oh, okay. I'm sorry. I told Daily News publisher Leonard Woolsey they named it after him. I'm sorry, Leonard, if you're watching the show, they didn't name it after you. I was wondering
sorry.
why it didn't have the spiked hairdo.
Exactly.
Had the glasses. No, I'm just kidding. I didn't really tell him that. For that, it just sounds so much as we're talking with Stephanie Farr from over the UTMB's operations in Angleton, Danbury, and the new Friendswood Clinic that's coming online, but also with Ann Verghese, who's here. She's the hospital administrator for the Clear Lake and League City. And having you two on here as we say all along, and this was the kind of the premise of the show, is that your healthcare is better when you have proximity
Mhm.
to that, right, Ann?
Yep.
I mean,
100%.
that's a big deal.
Mhm.
Having the proximity to the healthcare that you need is a major, major deal. Just talk, and Stephanie mentioned it earlier, but just the fact of I can go in, get a day surgery,
Mhm.
go home,
Mhm.
or even if it's just a one night stay. I'm not a 1 hour drive, 45-minute drive. Someone doesn't have to come all the way to the island. And no sense, no insults to
No.
Jeannie and John Seeley, but that now you're able to go, and be home in a
That's
reasonable
right.
amount of time. I'm sure that makes a big difference in healthcare, provided that both of y'all do.
Yeah, it really does because um, families want to be close by. But families, we all know, have other obligations as well. They have children at home, they have work to go to, whatever it may be. And so the healing process, I believe, is better when you have your loved ones near you. And if we make it convenient for families to be close by, to be that support system, the better off our patients are as well. The more we can educate everybody all around on disease processes, management of home, um, all of that, it just makes for a better process, a better way in which we can take care of our patients. Um, and really, it's what the community wants, right? The community wants to be close to home, and Galveston is phenomenal. There's so much that we do here at this campus, and Galveston will always be here to support and to provide that higher level of care that maybe some of our regional campuses cannot offer. And it's fantastic that we're a system and we're able to offer that comprehensive care all the way around. But receiving, most of your care close to home is a great feeling for our patients and families as well.
Yeah, there's no doubt about it. There's still stuff you got to go to Galveston for.
That's right.
I know it. I'm one of those who say, "Well, do you have a preference?" I said, "Well, not really. I can go."
Yeah.
And because I have an appointment later today with someone because I knew I was here. I said,
Yeah.
"Yeah, give it to me on Galveston."
Sure.
Go for there. Sorry, I just went blank on Stephanie's name. Sorry, Stephanie. I didn't mean to do
You
that.
can call me George. It's okay.
I'm not going to call you Leonard. I know that much for that, Stephanie. But I appreciate y'all both being on with us here today. And also thank you to Dr. Hay and for being on with us a little bit earlier today. And Peter also being on with us talking about that clinic in Texas City. We're going to try to do more of this, folks, because this was a discussion David Bethay and I had about, one of the things that when we're going to talk about healthcare, we can talk about the great, wonderful things that UTMB is doing in research and everything else. Comes down to it. First line of defense on health starts with y'all, and starts with those doctors, and we wanted to make sure we at least touched on part of that. There's a whole lot more we could do. The stroke specialties we're going to be talking about here because we had a story over the holidays that we'll be doing some more with a family we happened to met. A couple got engaged at Dickens on the Strand. As it turns out, it was a more emotional thing because the bride-to-be's dad had just had a stroke, being treated at UTMB Health through the stroke. That family is raved about the care that they've gotten, that stroke specialty up at Clear Lake. And so that's a big deal. And so we'll be talking more about all of those. Stephanie, any final thoughts about what you got going on? We're just looking forward to March 10th, aren't we?
We are looking forward to March 10th, but I can't say enough good things about the partnerships that we all have throughout our system and being able to transfer to higher level of care whenever we need to. And I think that's the beauty of us all being in one big system, is that if we don't have it close to home, we at least have it and we can keep everybody in one system, and it does provide for better care.
Between that and my chart, I don't know how to handle anything. I mean, as I said, it's all one spot, even though it's all local, basically, when you do it that way. Any final thoughts from you, man?
Well, I hope that our audience has seen a theme of the investment that UTMB has made in the community, because we want our communities to be healthy. We want them to have access to care in close to home. And there's been a lot of effort in recruiting the right people in order to meet those needs. So we hope that if you have not tried UTMB, that you'll give us a try. If you need hospital services, we're here for you in your backyard to help you out. And please go see your primary care. Please go utilize a specialist so that we can be a healthier community all the way around.
And Stephanie, both y'all, thank y'all for being on with us. We appreciate y'all coming on today. And it's been very informative for me, learning about the new stuff that's coming in as well. And this is just, as I said, just one part of it.
That's
the
right.
investment part is what you talked about there. And that's great. If you have more questions about what's going on, we have links throughout the show we've been giving you, so you can find there. The most important one is where to find a UTMB clinic that's near you. We have that link online for you to take a look at as well. And then again, we're looking forward to the new Friendswood clinic, which is going to be opening up at 1715 South Friendswood Drive in Friendswood, coming up March 10th. We'll be in there. Looks good from the outside. I can't wait till we see it on the inside there too. They got to finish it out. They got some stuff they want to finish out there to it. So again, to be able to do so. And oh wait, we had something from one of our viewers. And so Jacqueline Perrin had come in here highly recommending one of the doctors over there. She just calls him Dr. Peter. So that he was good to have on for sure on there with us. All right. Thank you all for joining us. We'll have another episode of this. This one, by the way, was delayed by a week because of the snowstorm. We weren't going to try to make everybody come hanging out here the day after. People had snowmen they had to go attend to for that as well. And an apology. I know you didn't see it there, but I had a typo in your name earlier. We fixed it, Dan. So
all good.
She's gonna take care of me next time I come into the UTMB
That's right.
Clear Lake Hospital for that. I'm gonna have to owe her a couple of Starbucks when I'm in there in line again next time around. Thank you both for joining us, and thank you again to Peter and Matthew for joining us earlier today. I'm TJ Alls. This has been UTMB Health Insights.